Section 2. Issues surrounding classification and diagnosis of schizophrenia. Key assumption is that mental disorders can be classified and diagnosed. A diagnostic system is a set of possible types of abnormality and the rules for recognizing them. There are two main classification systems in use, the ICD and the DSM. It is essential that they should be reliable and valid. Reliability. The reliability of major classification systems, ICD and DSM. Clinicians use either the DSM or the ICD, and both should enable them to diagnose schizophrenia reliably. This means that clinicians should be able to agree on a diagnosis if they follow the guidelines given in the manuals. Evidence for low diagnostic reliability comes from a study by Copeland et al., 1971. They gave a description of a patient to 134 US and 194 British psychiatrists and found that 69% of US psychiatrists gave a diagnosis of schizophrenia, but only 2% of British psychiatrists gave the same diagnosis. This shows that there is considerable cross-cultural variation in diagnosis. Recent research still suggests there is low reliability in terms of diagnosis. Wally, 2011, have found that inter-rater reliability correlations in the diagnosis of schizophrenia to be as low as 0.11. Implications. Treatment. The wrong diagnosis could lead to the wrong treatment being given. This is important because of the serious side effects of the drug treatments. Labeling. When a person is diagnosed with a condition like schizophrenia, they are also labelled, and these negative labels are hard to remove. A wrong diagnosis means someone runs the risk of carrying the stigma with them for the rest of their lives. Ways of dealing with the issue. Improve the manuals. There were many differences between early versions of the DSM and ICD. Those in current use are more similar but still contain some differences. For example, the main difference is that the DSM requires problems to have been evident for at least 6 months, and the ICD specifies just 1 month. Subtypes. There is considerable variability in the symptoms required for a diagnosis of schizophrenia. Individuals with totally different behaviours may have the same diagnosis of schizophrenia. Implications. The presence of subtypes makes a reliable diagnosis more difficult because of the variability in the symptoms and treatment outcome for the patients. Klosterkotter et al. 1994 assessed 489 admissions to a psychiatric unit in Aachen in Germany to determine whether positive or negative symptoms led to a more reliable diagnosis of schizophrenia. They found that using positive symptoms led to a more reliable diagnosis than negative ones. Validity. The manuals must enable clinicians to identify conditions that are clearly different from each other and which have different prognoses responses to treatment. Differentiating schizophrenia. There are problems with diagnosing schizophrenia as a condition distinct from other mental health problems, for example mood disorders like depression, developmental disorders like autism, or drug-induced psychosis. It is sometimes possible to use additional tests to make the distinction. For example, drug-induced psychosis can be differentiated by carrying out observation and toxicology tests. However, the matter is further complicated by the observation that depression is often comorbid, i.e., occurs together with schizophrenia. Implications. Jackson and Birchwood, 1996, showed that an early diagnosis and prompt treatment is associated with better long-term outcome for people with schizophrenia. Blurred boundaries with other disorders and comorbidity make early diagnosis and treatment more problematic, which may mean that the patient is less likely to recover. Treatment. Treating multiple disorders requires strict consideration of compatibility of drugs prescribed. Comorbidity makes it more difficult to predict the outcome of the disorder and likely response to treatment. Cultural relativism. Sections of the newer versions of the ICD and DSM attempt to highlight and deal with the issue of cultural differences. Davison and Neal, 1994, explain that Asian cultures, a person experiencing emotional turmoil is praised if they show no expression of their emotions, whereas in certain Arabic cultures the full expression of emotion in public is encouraged. Without this knowledge, a psychiatrist may see a person displaying either of these types of emotional behaviour as showing symptoms of schizophrenia. There is a consistent finding of higher rates of schizophrenia in African Caribbean patients in the UK and the USA. For example, Keith et al. 1991 found that 2.1% of black Americans were diagnosed with schizophrenia compared with 1% of the white population. This could be because doctors, who are generally not from African Caribbean community, misinterpret the symptoms. This is a serious problem because it might lead to the unnecessary labelling and treatment of people from different cultures suffering from schizophrenia.